Okay, next case. This one is infantile hemangioma. Usually we rarely get the biopsy sample of this type of lesion because from the history, the clinician usually know that it's infantile hemangioma. So for the clinical pathology finding, just like this lesion happen in the first few weeks of an infant, and they usually spontaneously involution. So that means for this hemangioma, when you biopsy, you may have two phases. The first phase is the proliferating phase. So you can see this aggregation, lobular aggregation of this tight packed vessel together, and then this collagen bundle just separates this nodule. In the proliferating phase, you may see mitosis, but this is still benign because you may have a really good clinical history. This lesion from an infant. And then the cells are really monotonous. You do not see really hyperchromasia cell there. Then combine all the history, and then this endothelial vascular lesion, you can call this infantile hemangioma. And then characteristic IHC staining is grade 1. So individual nodule like this. And then the other vascular lesion hemangioma is called the pyogenic granuloma, aka lobular capillary hemangioma. The growth picture just like this ectophilic, really red vascular rich nodule, usually in the distal extremity and even in the lip, in the head and neck area. This is another sample, this vascular nodule. The microscopic feature, if you call this pyogenic granuloma, you may not remember what it is, but if you call it lobular capillary hemangioma, you can see all of these features. Lobular, all of these endothelial cells, this vessel forming this lobular, 1 lobular, 2 lobular, 3 lobular. Then capillary means most of the vessels should be small, thin wall vessel, and then usually you will see one big vessel and then a lot of this small vessel just around it, just like this small vessel try to fit this big vessel. Big vessel, small vessel around, forming this lobular. This one also again, big vessel, small vessel around. Let's look at the cytology feature. They are really bland. Sometimes if irritated, traumatized, you may see tons of inflammatory cell, but that is normal. We also thinking this is not a true tumor, more like a reactive lesion, just like you get traumatized and then this lesion get more blood supply, so they get this reactive proliferation of this small vessel. So this one is pyogenic granuloma. Another example of pyogenic granuloma, lobular capillary feature. Even in low power, we know this nodule kind of extrophy because this is a normal epidermis, just a nodule growing out with this lobular structure, big vessel in the middle, and then small capillary vessel around. You can see they sometimes have these edematous stroma. Let's zoom in. Sometimes you may see tons of inflammatory cells, just like this lymphocyte. Sometimes you will see neutrophil, even eosinophil. That is normal. So pyogenic granuloma. Let's see one more case. This one may be still like nodular extrophytic growth. Even in this low power, we can see they're forming kind of lobular and then small vessel. Again, this kind of edema stroma also characteristic. Let's zoom in to see the cytology feature. This one we can see tons of inflammatory cell. This is neutrophil. Tons of blood vessel trying to fit in some larger dilated vessel. Pyogenic granuloma. For the next case, this cavernous hemangioma, the growth picture just like this plaque-like vascular lesion, also in the young age. The characteristic feature, just like we can see tons of these dilated vessel filled with red blood cell, and then they aggregate to forming this kind of hemangioma, and then the cell is really bland looking. They do not have infiltrate border. They just like pushing around the surrounding tissue or even merge in the normal tissue. You can see fat, subcutaneous fat, acquired gland, and small vessel around. So this cavernous hemangioma. This is another cavernous hemangioma. Even this one is a relatively big lesion. We can see tons of red blood cells inside this dilated vessel, and then all these dilated vessels trying to forming this hemangioma, tumor-like lesion, but totally benign. Make sure to check the cytology. We do not see hyperchromatic, really atypical cell, and usually you do not find mitosis. Let's see the next one. This one is Masson tumor, aka papillary endothelial hyperplasia. This is another reactive lesion, but you can see in this dermoscopy, we can see this vascular lesion, tons of dilated big vessel with this thrombi. Actually, this is a truly reactive hemangioma. Even we have a name Masson tumor. The pathophysiology changes is like we have a big dilated vessel get thrombi, and then all the endothelial cell just try to grow inside this thrombi to get recalculation. That means this endothelial cell, because of lack of oxygen, so they try to proliferate to get more blood to fit the whole lesion. So when this endothelial cell grows inside this thrombi, you can see this papillary structure, but this is truly benign because you can see all the endothelial cell proliferation, just like bland looking endothelial cell. And then a good feature is that you see a big dilated vessel, and then all of these papillary structure just grow inside. They don't have infiltrated border, so that's a really good sign for this papillary endothelial hyperplasia, Masson tumor. See this papillary structure, but just recalculation of a big thrombi in a big vessel. For this one also the same, really big vessel, just get a big thrombi, this fibrin deposition. Then this endothelial cell just try to grow inside to dissect this big thrombi and forming this papillary structure. This is another Masson tumor, papillary endothelial hyperplasia. Also, we can see big vessel get thrombi, and then all of these papillary structure just grow inside. You won't see any this papillary structure growth outside. Of course, if you go to high power, you may see some, oh, maybe this is hyperchromatic, suspicious for angiosarcoma But when you see the overall architecture, just like everything grows just inside this big vessel, no infiltrated border. Just like this one, you can clearly see all the papillary structure just inside this blood vessel didn't go out. High power, we see this papillary structure. We also see a lot of red blood cell. So this is just a reactive process. Intravascular papillary hyperplasia.